My name is Tiara Davis, and I am presenting on mental health in Hispanic cultures, which is what I did write my essay over. Mental health, as many of us know, is very important to the individual's quality of life. Rather than just being alive and surviving, you are able to be happy. Many professionals do know that mental health impacts your physical health as well as physical health impacting your mental health. And so in order to be a well human being, you need to have both mental wellness and physical wellness. Healthcare does have its disparities amongst minorities, and including that of Hispanic people and those who come from Hispanic cultures. And it's very important that we understand that people who have Hispanic cultures don't have access to healthcare either because they are immigrants, they are unemployed or self-employed, so they don't get that healthcare from their employers, or they just don't feel comfortable going because of the language barrier. So either if they do speak English, they don't have the quality of English that they can understand medical terminology that a doctor or another physician is going to be talking to them, trying to engage them into their own health. One thing Hispanic cultures are very well known for is their strong social units and their strong ability to have extended families, and they are very comfortable with each other and they have a good social standing. And there is strong evidence to support the fact that if you have a strong social support system, you are able to have a better mental health, as though you feel more supported and less isolated and alone. And so being able to have that support allows people to not just not have mental illness. They can still have mental illness, but you have that support so you can go into remission easier, and oftentimes without having to go to a doctor or a psychologist to have to talk out your issues. This chart right here shows the population of the US by race or ethnicity as charted by 2011. And so as you can see, not surprisingly, we have the majority of the population being white or Caucasian. And out of the minorities, you can see that Hispanic people actually are the largest minority in the population of the United States. Out of all of the Americans who are not covered by healthcare insurance, 1 in 3 of those Americans are going to be of Hispanic race or ethnicity, which just goes to show the disparities between the disparities in the healthcare system. This image is showing you an example of a doctor who has an interpreter to help give those who don't speak English or those who have a harder time understanding the mental terminology in English. They have an interpreter there to help ease that language barrier. And there's even an increase of doctors or other physicians who actually do speak Spanish on their own, so there's not the need for the interpreter. But where the issue still lies is that those people, even though they understand the language, they may not understand the social barriers that are occurring for those in the Hispanic culture community. And there's many studies that have been done that help show the impact of culture on mental health. And this is just another example of how the culture of having a strong social unit doesn't necessarily have a direct correlation between having an increased mental health, but there is evidence to show that your mental health can go into remission. Instead of being depressed, you can actually start to feel better just because of those strong social connections that you are being able to make. That is normal in the Hispanic community.